Suspected endodontic failure in a patient with cleidocranial dysplasia, a case report done by Dr. Kasperek in Liverpool 2023. Cleidocranial dysplasia or dysostosis is an autosomal dominant genetic condition affecting tooth and skeletal development with a prevalence of 1 in a million, and it was first identified by Martin in the 1765. It has been reported to affect intramembranous ossification caused by a mutation, insertion, or deletion of the SBFA1 gene or known as the RUNX2 gene. Typical presentation involves the underdeveloped or absent clavicles, shorter stature, and skull abnormalities in the frontal and parietal bossing, a hypoplastic maxilla, and delayed fusion of the cranial suture, which lead to a protruded mandible and mid-face retrusion. Also, dental abnormalities, including delayed exfoliation of primary teeth and delayed eruption of primary and permanent teeth, occlusal abnormalities, and supernumerary teeth, which leads to crowding and resorption. So, in the case report, she's an 18 years old female patient referred to the endodontic department because of the suspected failed root canal treatment on the maxillary left central incisor. It was previously seen at the pediatric department 2 years prior, presenting with a discolored tooth and that did not respond positively to sensibility tests. After the diagnosis of the pulpal necrosis and asymptomatic apical periodontitis, primary endodontic treatment was completed, and the tooth was been asymptomatic since. So the medical history includes the cleidocranial dysplasia with no known family history of the condition. And the dental history includes multiple supernumerary teeth extraction and the general anesthesia at the age of 10. The patient reported no signs or symptoms. The clinical examination reveals normal responses to sensibility tests of the adjacent teeth and no tenderness to palpation and percussion testings of the anterior teeth, and no evidence of sinus or discoloration or deep periodontal pocket or mobility or coronal leakage. The new referral supplied periapical radiograph, which showed a well-condensed obturation with the presence of radiolucencies at the apex of the tooth, consistent with the appearance of a periapical periodontitis. So, in this stage, the main differential diagnosis was asymptomatic apical periodontitis of the previously treated tooth, number 9 in this case. So, a CBCT was taken. Indicated that tooth number 9 was well obturated and has an associated periapical radiolucency, which was interpreted by an oral and maxillofacial radiologist with a reporting of a low density apical region measuring approximately 5.6 millimeter in the mesiodistal direction and extending approximately 2.7 millimeter superior to the apex of the tooth number 9. And the periapical area was reported to extend through the buccal and palatal cortical adjacent to the apex of tooth number 9 and through the adjacent floor of the nose. So because of this previous medical history of the patient and the dental history as well with the supernumerary teeth extraction, previous CBCTs were requested to analyze and determine the number and the location of the supernumerary teeth. So upon the assessment of the CBCT records from 8 years prior, the presence of a supernumerary teeth was noted in the anterior maxillary region, and the position of the current observed radiographic radiolucency was closely related to those supernumerary teeth that was previously surgically extracted from the maxillary anterior area. So they also found a CBCT record 2 years prior. They started the initial endodontic therapy and they showed no changes in the side of the radiolucency before and after the completion of the endodontic treatment for this. The patient was diagnosed with apical scar located in the anterior maxilla associated with the apex of the central incisor that was likely caused by the surgical extraction of the supernumerary tooth in the anterior maxillary region because of the absence of evidence of active disease and no changes in the radiographical appearance. No treatment was deemed necessary. So in this case report, highlight the importance of through the history taking, especially medical history, and the associated supernumerary teeth. And this article also highlights the importance of the investigation, especially for the medical and dental history that might lead to misdiagnosis and unnecessary treatment of the affected teeth.